And welcome in, everybody. My name is Dr. Tim Brown, your host of PharmCast for the Community, as always, sponsored by the University of Georgia's College of Pharmacy. Joining us today, we're going to have someone who talks about allergies in general. And I'll tell you guys, moving into Georgia over the past couple of years, I didn't realize the allergies I didn't have until I got here and realized I actually had them. So we're going to talk about that for the next, hour or so, maybe a little bit less. But I want to warn everybody that in June, I'm actually going to bring up someone that's going to talk about sunscreens and how to keep us safe in the community. And when I say by warn you, this person is a pharmacist that works in a dermatology clinic. So she has a vast amount of knowledge. I think she's going to blow your mind with what she's going to tell you. And I don't think a lot of people think about pharmacists working in dermatology or skincare, but she's going to come on and talk about how to use sunscreens, how to keep us safe for the summer as everybody starts to travel again for vacations. That'll be in June. But before we get to June, we actually have to get through May. And so today I get to welcome Dr. Andrew Blake. Hi, sir. How are you?
Hey, Dr. Brown. How are you? Thanks for having me on.
No problem. I know you are a 2020 graduate of Mercer University with your PharmD degree, correct?
Yes, sir.
But before you were a pharmacist, you worked as a pharmacy technician for how many years?
Let's see. I was a technician starting in 2001. Then started pharmacy school in 16, so that's probably about 15 years there.
Wow. I don't think people realize the amount of support and backbone pharmacy technicians add to the profession. And then also pharmacy technicians today have a whole new role in pharmacy. It's expanded such a great deal. So, obviously you had a great career there. What prompted you to go to pharmacy school?
Well, I should have done it a long time ago. So what prompted me, I felt like it was a good fit for me. I never considered myself someone to work in the medical field until I had worked as a technician for so long. Every pharmacist you talk to says the same thing, that they have a passion for helping people.
True.
And that was very true with me. I had issues with my parents passing away while I was a technician, and that just the way that the whole healthcare system supported me, supported my parents through the whole process. I just wanted to be able to give back into that process, and pharmacy was the natural fit. And it turned out I was good at this. So
I love that.
This is
I
great.
have no doubt that knowing that you were a technician for 15 years and knowing how hard pharmacy technicians work, I have no doubt you're going to be good at pharmacy in general, because you walked in with a vast amount of knowledge. But now you're working for Gwinnett Drugs, correct?
Yes, sir.
How long have you been there?
I got on board with Gwinnett in this past December, 2020.
Wow. So Gwinnett is an independent chain pharmacy. You have more than one store, correct?
We have the main store, Gwinnett Drugs, is in Lawrenceville, and we have a couple of sister stores that are throughout Gwinnett County, as well as a clinic in Salveo Integrative Health, which is a behavioral health and psychiatric clinic as well.
Oh, wow. So a lot of different avenues I didn't realize that. That's great. Also, I know that you served as student leadership on the Council for the National Community of Pharmacy Association, but also you were the president of the organization's local chapter. So not only are you working your day job, you're doing a lot for the profession in terms of promoting community pharmacy as well, it sounds like.
Yes, sir. I try. It's my background at Kroger. I just had this very limited view that I didn't know anything about independently owned pharmacies. So when I got into pharmacy school at Mercer and was introduced to the National Community Pharmacists Association and how they support the independent business owners that make up such a huge portion of pharmacy, I was drawn to that. So I got as plugged in, as involved as I possibly could. So
I love that. I love the
glad
fact
to stay on board with it.
I love you started as a student, that you had that passion even as a student. That kind of advocacy, I think, for our students here at UGA and other colleges of pharmacy. People don't realize that students start very early on working for their profession and trying to advance the profession, while at the same time they're learning within that profession to become a pharmacist. It's impressive what students do these days with everything on their plate. Gwinnett Drugs, several locations, working there for a little while now as a pharmacist. One of the key things that I think that a lot of people talk about is that, people who walk into a community drugstore or pharmacy, we call them customers, but I don't really think they're customers. I think they're more like patients, right? They're walking in. How many folks are patients do you see in a day come and talk to you, or you help them with services as a pharmacist?
Oh, I say upwards of 50. We're not going to see the same numbers of volume coming through as you would see at like a grocery store.
Right.
I think the patients who come through they have a very strong intent. They made it a point to come in and see us. So yeah, easily upwards of 50, 60 a day. Just not even those picking up prescriptions. They just saw, here's a pharmacy. Maybe they have what I was looking for.
And,
So
and how many of those folks have you built I mean, 50 or 60 a day, obviously that's a lot in a month, but how many of those folks do you recognize on site? They walk in the door and you're like, oh, Mr. or Mrs. So-and-so are here. Or, this guy dropped by last week and I recognize him. My guess would be you've made some friends and built some relationships.
absolutely. I think almost every person that comes in that door, I try to treat them like they're a good friend of mine, even if this is the first time I've ever seen them. And it sticks. The patients realize that they're welcome in our pharmacy, and they understand that I am there to serve them, and they enjoy coming back.
I see. I love that. I guess, I came from ambulatory care. I worked in a primary care clinic for about 26 years. So I love interacting with people. It's fun for me. It's also, as you said earlier, I get to go home at night and lay my head on a pillow knowing that I helped somebody today. And I
Right.
get the feeling you're exactly that same way. During this whole last year, it's been a mess, but pharmacists have really stepped up to the plate. Have you
Mhm.
guys been involved in taking care of patients who were trying to prevent COVID or actually had COVID? Have you been involved in any of those patients' care?
Absolutely, we have. So we work pretty closely with a primary care office just down the street from us in Lawrenceville. Dr. Coons, David Coons' practice, and he's a big proponent of using immunity boosting vitamins. So he came up with an entire formulation that he was recommending to all of his patients. And I work some days at his office as well doing chronic care management. And he reached out to me and said, hey, is there a way that we can get this sold in the pharmacy as well? Well, we also, one of our services is adherence packaging, like the rapid pack strips. So we got his formulation, put it in the packages, and was selling that as a one-stop, immunity boosting supplement for our patients who came in and wanted something to help out. And then we also got involved with vaccinations back in December. So I think every day we've had some sort of clinic going to vaccinate the public. It went at one point where our phones would not stop ringing because at one point we were the only pharmacy listed on the Department of Public Health's website in
Yeah.
Gwinnett County that had vaccines.
It's interesting. I noticed that when I was looking at the vaccine rollout in December, because we did a special segment in January with a couple of infectious disease pharmacists who talked about the vaccine and what's going with it. I noticed Gwinnett Drugs was prominently listed on the Department of Public Health's website. But you said
Mhm.
something in that I'm like, what? You do chronic management at a primary care office, and you work at Gwinnett. Your schedule sounds kind of crazy. So what do you mean by chronic management? What do you do at Dr. Kuntz' office?
So Dr. Coons has brought me on to just kind of flesh out his team with mid-levels, and now he's brought a pharmacist on. Chronic care management is something that Medicare pays for. So if there is a Medicare patient that has at least two chronic diseases,
Right.
whether it's hypertension, whether it's hyperlipidemia, type 2
So
diabetes.
So high cholesterol or having diabetes or hypertension,
Mhm.
you get to take care of them if they fall into the Medicare
Correct.
category. Oh,
Correct. So it's more of a cost saving measure for Medicare in the long run. They're more than willing to pay for that service. The difference is that this is usually something that nurses or mid levels perform. To my knowledge, we're one of the few uh, clinics that are actually employing a pharmacist to do this,
yeah. I did
which
a little
he
bit.
loves.
I did a little bit of this when I practiced as well. It's a lot of work too, because there's a lot of documentation that goes with that. But my
Absolutely.
guess would be, and I consider pharmacists to be mid-level providers along with nurse practitioners and physician assistants. So you're working that role. My guess would be that the patient care has gotten better because the pharmacist was added to the team. That's my, that I'm biased, but I'm going to say that's my guess.
Absolutely, they love it. The way I pitch the service to the patients initially is that I'm going to be your VIP pharmacist now. This is a concierge sort of thing at this point. I'm much easier to reach sometimes than the
Yep.
other practitioners in the office,
Yep.
and I know. And what's good to hear though is that I have patients who say my pharmacist at Publix is the best pharmacist I've ever had, and I've been with them for 10 years. I'm willing to give you a shot, but you're going to work together with them to
Right.
take care of me. Like,
See,
that's fine.
I love that. And I think people don't realize pharmacists actually talk to each other across venues. So pharmacists who work in hospitals talk to people who work in the community, people who work in offices talk to community. I mean, it is one big discussion in family. So we're always talking about you guys behind your back, just so you know. We're always trying to figure out how to make things better for you. One of the things I wanted to talk about was you get, as you said, you get 50 folks in your office in a given day here or there. I would imagine that you get a lot of questions. Some people that just pop in to pick up their medication, I'm sure, but there are other people who kind of walk in and wander around looking for something. How often do you get involved helping patients kind of scouring, looking through the store, trying to find a specific drug or over-the-counter remedy for what they're having problems with?
I'd say, it's getting to where I can look out there and I see a patient who's just got that bewildered look on their face. Like, that they're hunting for
Which,
something.
by the way, Andrew, that's me all the time. Just so you know, so you know. Yeah.
And maybe it's just how I am, but I want to see if I can interject, because a lot of times people have questions, but they don't know that they can stop a pharmacist to ask. We're too busy, or maybe, or it's a pride thing. I can figure this out myself. So I'd say probably out of those 50 a day, I'm talking to 20 or more. So at least half.
Wow.
If it's not been directly asked of me, I'm going to interject myself in their search.
Well, and I want you to come on and talk about allergy medications. And the reason I asked that question is to get ready for this. I actually took a couple of days and wandered through various stores and looked at the shelves. I went from the big box stores to the smaller stores, and I'm a pharmacist. I've practiced for a long time. I was overwhelmed with the number of products in the cough and cold aisle, the allergy aisle. While some cough and cold looked like allergy medications, some allergy medications took care of my cough and cold. I'm like, what is going on? And as I mentioned, I've been here about 2 years now. The pollen here is a whole nother world.
Oh, geez.
It's another level. So tell me a little bit about, I have to imagine in this time of the year, some of those 20, 30 questions you get, they have to be centered around how do I take care of my stuffy nose, my itchy eyes, my runny nose, my ears hurt. Allergies are just painful, man. When the seasonal allergies come in, I'm going to guess, tell me if I'm wrong, some of those questions center around, please help me get through my day. I can't even think anymore. I'm so stuffed up.
Absolutely. It's when you've come to the point where you're coming to the pharmacy and you're trying to self-treat something so that you can continue to be productive throughout the day. We're talking about people's ability to make money here. So whatever we can do to fix this.
Drive their car, buy groceries, take care of their kids, go to their job. There are days that allergies have drained me so hard. All I want to do is just crawl into bed and just sleep because I've not been able to breathe all day. And you, as you point out, self-treating, right? I can make an appointment. I can do all those things, but there's an allergy aisle right there. Why can't I just go? I can build it. I'm a man. I've got this. Now, that's not sexist. I'm saying that's in my brain, and I've got this. But I was overwhelmed reading all the packages, trying to figure out, do I get the generic? Is the generic the same as this product? When you're looking at these and talking to people, how do you, first of all, figure out, how do you start talking about which drug is going to work for them? How do you help me narrow down that aisle, if you will?
Well, you sort of have to ask the patient, what can you describe to me exactly what's going on? You can say, I have allergies. We'll be a little more specific, because then we're going to target in exactly how we're going to treat this for you. So are your allergies the scratchy eyes that are watery and you just want to rub them until they fall out? Or is it the runny nose? Is it running nose out the front? Is it draining down the back and causing you to cough? Are you able to produce anything when you do cough? And that's it's sort of like a mental checklist in a pharmacist's head. And we start thinking about, all right, so no, yes, no, yes. All right, so I'm going to zone right in. We're going to get something to dry this person up. We're going to get something to quiet a cough. And then we're going to go from there. We're going to eliminate a third of that aisle and just zone in on one thing.
Oh, I see. So really looking at the symptom, like what the patient says, and that helps you kind of move in. So tell me, what's the number one product or the number one thing that you should use for your allergies according to guidelines? Like, what is the thing you recommend the most?
Guidelines, it's changed a lot, but what we're noticing now, guidelines are recommending to go with those nasal steroids. So the biggest one that you see is Flonase.
Mhm.
Flonase and its generic equivalents, which is fluticasone propionate. But
Okay,
then
is it
again,
okay? So I'm going to ask this question because these things are expensive.
hmm,
So is the generic as good as that brand? Can I get the generic and get the same results if I and save, almost $20? I just bought Flonase the other day. So I think I saved $20 going to the generic.
yeah, absolutely. The generic. So when a manufacturer produces a generic equivalent of a medication, in order for it to be allowed to be sold, it has to have the exact same active ingredient in it as the name brand. So when the GlaxoSmithKline makes Flonase, the active ingredient is fluticasone. That's the nasal steroid in it. So when the pharmacy has a generic equivalent, it has to have the same concentration of fluticasone in that as well. The only difference is the packaging, or maybe Flonase has some sort of fragrance added to it, or things like that they don't actually affect the drug itself. So
Got it.
you could go the generic route and still have the same efficacy that we're talking about.
So are there others that are over the counter or OTC? You mentioned Flonase. Are there any other choices that one would have for intranasal steroids, right?
Yes, sir. Although there's several. So when we're looking at Flonase, and this is where it gets confusing. You have Flonase, and that's fluticasone, and then you have another Flonase, which is called Flonase Sensimist. And the difference between those is just the type of fluticasone that's in it. One's a little more potent than the other. Each time you spray it, it's not as much drug as the other one. It's a little more efficacious, I want to say, but again, the drug itself is the same. So you're really just looking at which product is best for me. Do I want more volume going up my nose or less volume going up my nose?
Well, and also your pocketbook, right? Is one more expensive?
Absolutely.
Yeah, I mean,
Absolutely.
but they both work well. And I think the others on the like Rhinocort isn't it now over the counter as well? What's another one
Rhinocort.
that's over the counter?
You could do Rhinocort, but we also have Nasacort as a product over the counter. And these of course, the brand names of these drugs.
Right.
Nasacort is triamcinolone, and Rhinocort. See, I never see Rhinocort. I can't remember. I think that's budesonide.
Got it.
However, they're all nasal steroids. They all are roughly going to be working about the same. Uh, what I typically recommend to people is go for the one that's cheapest first. If you've never used any of these nasal steroids, go for the least expensive one. If that works for you, you've just saved yourself a lot of money.
That's a good point.
And then move up the ladder of expenses until we find one that works best for you.
Well, and I think, let's go back for a second because intranasal steroid, the word steroid scares people to death, right? I mean, it's a little different, but this is a steroid that's aimed at stopping your allergy symptoms in and around your nose and your sinuses. It doesn't really go anywhere else, right?
Right. Yeah. As a nasal steroid, these are considered topical steroids. So it's just being applied directly to the inside your nose, and it's only affecting the receptors in your nose to actually that cause that allergic response that's happening in your body. It's not going to be distributed systemically throughout your body, and you have all the side effects that come from taking oral steroids, say if you have a cold or we're trying to suppress your immune system.
Right. So I'm gonna take your pharmacist talk, and I'm gonna say stays in your nose and it calms your sinuses and your nose down, so you're not as stuffy and you don't drain as
You
much.
got it.
How
You
do
got
you?
it.
I think the thing for me, and you said this earlier, the smell, but how do you take these? Because it comes with that little compressor thing, and each one of them is a little different. But can you go over how you do an intranasal steroid to get the best effect from them?
Absolutely. Absolutely. So with an intranasal steroid, now, like you said, each of them is going to have some sort of different mechanism, but generally they're all the same. They're going to be in some sort of push bottle. When you first open that up, you want to make sure that you prime that push bottle, the compressor, the actuator. You actually want to be able to see that spray out. You don't want to waste any doses in your nose. You think you got it, but nothing actually came out until it's primed.
Got it.
So you spray it a couple of times so you actually see the mist, and you want to lean your head forward and place that nasal, I guess the actual part that will go up your nose.
The nozzle. I'll call it
The
the nozzle.
nozzle. I
Yeah.
like that. The nozzle will go straight up your nose, and you're not tilting it towards the middle of your nose, your septum. You want to try to get it as straight up as possible and tilt forward and do your sprays, however many the packaging instruction says to do. And that'll ensure that it's going up your nose instead of leaning your head backwards and spraying, where it could run down the back of your
And you
throat.
lose the drug. Oh,
And you lose the drug down your throat instead of it being applied into your nose.
that makes perfect sense. And I think, season's here, but it takes a little while for these to, I mean, they can work quickly, but really for the full impact, how you should use these often, like every day, right? You just can't use them as you need it. It's got to be something you do every day, right?
Right. With a nasal steroid, this is something that you have to commit to using daily. They work best for patients who have persistent allergies year round. If you know that we're hitting pollen season and this is going to bug you the entire, it's in Georgia for the next 3 to 4 months, go ahead and start your nasal steroid and continue to use that throughout the entire time. Try not to miss a day. We're talking about adherence here. And even after the symptoms subside and you no longer feel like, okay, I've gotten to the other side of this pollen season now, continue using it for a couple of days after that, because then there won't be any rebound effects as well.
I read that when your allergy season kind of ends, if your season ends, you should use it for a week past the season if you can figure it out.
Right.
I will tell you that there are many people who have allergies year round. So it's okay to use this year round, correct?
Absolutely.
But you said something earlier that you're working in conjunction or interprofessionally with a physician. I feel like I should tell my physicians that are taking care of me if I buy something over the counter and I use it every day. I feel like they should know that because it's not a prescription they wrote. I feel like it should be on my medication list. Mm-hmm. Am I being too OCD about that, or is that what you would recommend?
Not at all. That's actually a big part of my job as working in primary care, is finding a medication reconciliation. That's what we call that.
That's a big old word right there.
It is.
You just matched up medications, what I take with what you have down, right? That's yeah.
That's what it is. That's saying, okay, here's what I have on file for you, and this is everything in your pill box and your medicine cabinet. And I need those two to match up.
I think that's important, because when I walk into a pharmacy and you're helping me out, that doesn't get also recorded anywhere. It kind of is on me to make sure that whomever's taking care of me, I need to tell them, yeah, I picked this up and I'm using it every day versus I used it for a couple of days.
Right.
Yeah.
Absolutely.
To me, yeah. But as we get into this, there are some other medications I want to talk about, but if you have high blood pressure, diabetes, lipids, your thyroid's out of whack, some of the products we're going to talk about in a second can really cause some problems, right?
Absolutely.
So before you jump on any of these, also let your pharmacist know kind of some of those diseases that you're dealing with, some of those chronic things that you're dealing with, because that would change your recommendation, right?
Absolutely.
Yeah. So let's leave nasal sprays, because I think nasal sprays work for a lot of people. But the one that everybody talks about, and gosh, we know it's been around since the beginning of time, is Benadryl.
Oh yeah. Good old Benadryl.
Good old Benadryl, right? I mean, you can use it for everything from a cough to a bee sting. So tell me a little bit about that drug and sort of the class it belongs to.
Yeah. So like you said, Benadryl has been around since, the dawn of time, it seems. Benadryl is in a class of medications. We call them first generation antihistamines. That just means that it was the original ones that were developed to stop an allergic reaction.
Right.
So Benadryl is the brand name, but the generic is called diphenhydramine. And again, the reason I give you the generic name is because that's usually what's printed on the generic packaging at the store. The drugs that are considered first generation antihistamines are, even though that's the ones that we grew up with and that's the first thing that springs to mind, that's not necessarily the one that's best for us. There's lots of side effects that spring up from using those first generation antihistamines. The main one that I think of, especially with Benadryl specifically, is sedation.
All right. That's a lot. You're doing pharmacist words again. What is sedation? Just like if I were telling my dad what Benadryl is going to do to him, what word would I
Mhm.
use?
I would say you're going to be sleepy.
Yeah,
You're
yeah.
less likely to respond to things. Don't drive, don't operate
Oh,
machinery, don't do anything that requires your attention while you're taking Benadryl.
yeah. I think a lot of, and some people take Benadryl to sleep at night, so they probably know that, but I don't think they realize we actually tell people if you're watching your kids for the day, or if you've got to do some work that requires your brain to be in top-notch form, and you talk about driving or even like operating machines at work, they suggest that you shouldn't be using Benadryl. And what are some of the others that fit in that category? Benadryl, and what are the others?
Oh, the other one that springs to mind is one called chlorpheneramine, and that the brand name of that was chlortramaton. It's kind of hard to find the brand name now,
Yeah.
but it's usually a little yellow first generation antihistamine, and it's hard to find that one by itself. That one's usually in combination with other products, as it's considered a less drowsy uh,
Oh,
first generation antihistamine. But I think a lot of patients are afraid of Benadryl, so they go with chlorpheneramine. But that one's the same thing. It can cause drowsiness as well.
that's a good point. And then when we grew up, we were on Dimetap, bromahist. I mean, it
Mhm.
was this purple stuff that tastes like Kool-Aid.
Oh yeah.
It was the best kids and but it knocked you out. It's funny you bring that up about combination products. I don't think people realize that if you kind of do a shotgun approach, you might take medications you don't need, like you don't have those symptoms. So if you buy like an all allergy and it has chlorpheneramine or has diphenhydramine, you could be getting this sleepy drug and not even realizing it when all you needed was something to unstuff your head.
Right.
So
Correct.
you probably play a big role in that when somebody walks up and goes, what's this list of drug? What do these do? Because I have to
Right.
admit, like NyQuil, I'm not calling anybody out, but NyQuil is a great example. It has two or three pretty decent ingredients in it that can rock your world if you don't know what you're getting.
Absolutely. Yeah, it's part of that first question when I ask a patient, "What's going on with you? Describe it to me." If if you know you're not mentioning that you're stuffy, then I'm not going to recommend something that will unstuff your nose. So, and a lot of times that's in there as well. If you don't have a stuffy nose, then your sinuses are likely not plugged up. It's not causing you a sinus headache. So why do you need a product that has Tylenol or acetaminophen in it as well?
It's a good
So
point.
let's save you some money and narrow all this down. Get to the meat and potatoes. What's going to take care of you?
And I guess minimize the amount of drugs, right? Like every drug has
Right.
side effects, every drug has interactions. So the least amount of drug you need, the better. You said, talking about walking in. If a parent walks in, are some of these drugs good for kids as well? For example, we talked about intranasal steroids. Let's say I don't want to give my kid a pill because I'm scared to death of giving a pill or a liquid. Can I use the steroids in kids?
You can use the steroids in kids. A lot of them have a specific labeling. They'll have a children's formulation, which each spray of that nasal steroid is a reduced dose of the adult version.
Got it.
Children, we look at children ages roughly 3 to adulthood. They're totally okay to use a intranasal steroid. Um, any younger than that, I'd still recommend you take your child to the pediatrician and get their professional opinion on it. I really steer away from self-treating very young infants.
Yeah.
um, but I will agree that if you can't even find the children's formulation of a intranasal spray, um, we can recommend how to adjust that daily dosage as well
We're
to
talking.
accommodate a child.
You bring up a good point about, when you talk about kids not wanting to give them drugs because we're not quite sure how they're going to react to it. So that Food and Drug Administration said, less than 3, let's kind of watch these OTC or over the counter products, but
Mhm.
also older people. And I'll throw myself in this mix. Older people can have side effects that are greater than what was expected, maybe for someone who's 30 years old. So that
Absolutely.
sedation or sleepiness thing, if I were an older person, it might cause me to also fall because it, yeah, I really am pointing this out because I think everybody's different. And so I don't want to say that everybody needs to walk in and get a steroid or a Benadryl, that you really do have to look at a lot of different things here. It's not just, you made it sound easy. I ask you what's wrong. You tell me the symptom, I choose something. You're looking at their past medical history, what diseases they're living with, the medications they're on, how old am I, what do I need to accomplish? over this next day or month, depending on how long I'm going to be on this thing. So that's a lot of decision making in that
Yes,
one aisle.
absolutely.
Oh,
It
wow.
is.
So we talked about old antihistamines. I think a lot of people know where I'm going with this, but they got better, right? Because
They
I
have.
like you, I grew up with allergies, so I was on Dimetap until we got better antihistamines where I could actually function and take it every day. What are some of those called?
So we're looking at the newer, their second generation antihistamines. A lot of these, you'll probably remember within the 20 years I've been practicing pharmacy, a lot of these were prescription drugs just until recently. This is the Claritin, the Zyrtec, Allegra, the new guy on the market is called Zysol.
Yeah.
These are, they're still very effective at blocking that allergic inflammatory response. I'm still using these big words, and I apologize.
Okay, I get it. But honestly, antihistamines dry you up, right? They
They
stop you
do.
runny nose and run down the back of your throat. So people go, well, what are they used for? You just said it. It stops your nose from getting all gushy and it dries you up. So if you have a runny nose or it's going down the back of your throat, this is the class that we're looking at with the steroids
Exactly.
that help. Okay.
Exactly.
Yeah.
Exactly. The thing about these antihistamines, especially these second generation antihistamines, like we already mentioned that the go-to nowadays are the nasal steroids.
Right.
That's something you have to take every day. These antihistamines are something that you could take as needed. The the nice thing about these second generation ones, specifically the Claritin, the Zyrtec, a lot of these are only dosed once a day, just like the nasal steroids dosed once a day. But if you have allergies that are just every so often, then it's okay to have a bottle of this, take it for a few days, and you're good to go after that.
And the side effects for these are a little bit less, right? So I don't get as much sleepiness or there's not as much danger
Right.
with falling down with these.
As compared to the Benadryl. Right. There's, in fact, the packaging on Claritin and Zyrtec, it'll say non-drowsy or less drowsy. In fact, almost any product that says no non-drowsy formula likely has one of these second generation antihistamines in it. There are a couple, specifically the Zyrtec and Zysol. They're close cousins to each other. There's some patients that experience some sedation or sleepiness, not nearly as much as you would with Benadryl.
Right.
But as a point of just a rule for me, I always tell patients, take this one at towards the evening at bedtime, right before you're getting ready to go to bed, just in case. Just in case.
I was telling someone, actually some of my family, that they didn't know how they were going to react to some of these. And I said, you know what? Take them, if you don't work on the weekend, take them on a Friday night. That way, if you're groggy and hungover, you have Saturday to recoup and you kind of know what the drug did to you.
Right.
I tell people this because if you're going to try something new and you're not quite sure, give yourself a little bit of lead time in there. Don't get so mad at yourself if the next day you don't live up to your regular standard. Because I think some of these can still have a little bit of an effect the next day where you feel a little drowsy. Yeah.
Mm-hmm. They have a little bit of a hangover effect.
Yeah. And now
Yep.
these new ones also they're good for kids too, right? There's some
They
kids.
are.
Yeah. Okay. I'm thinking about parents out there going, well, my kid's got a stuffy nose. What's safe? And there's a lot of the Claritin, Zyrtec that have formulations just for the little ones.
Absolutely, and they're the liquids, the syrupy formulations that are have the sugary taste to it, that
Right.
or the bubble gum flavoring that's more likely the kid is going to be acceptable to taking this medicine. Just like you said before, the Dimetap, that one would knock you out, but it tasted good.
God, it tastes just like it did. It was like grape juice. But you bring up a good point about dosing. And this is where I think they should talk to pharmacists if you're a parent. It's hard sometimes to figure out what that stupid bottle is trying to tell you to give your kid.
Mhm.
Like a teaspoon is 5 milliliters. Now, most people
Correct.
be like, what is that mean?
Mhm.
And then do I fill the teaspoon all the way up? What if some of it drips over? What if I use one of those little cuppy things and some of it's still on the bottom? So my guess would be you get questions like that too. But
All the time.
I read an article that parents either overdose or underdose their kids a lot of times with over-the-counter drugs because those little things are so hard to read.
They are.
Yeah.
Yeah.
So
That's and almost all those the kids liquid formulations will come with some sort of dosing cup.
Got it.
However, like you said, sometimes the plastic on it is not clearly labeled, or it's not dark enough to see. So I've had a lot of times where a child's parents will just use a teaspoon out of the drawer, and a teaspoon, an actual teaspoon that you put a scoop of sugar into your coffee, is not the same measurement teaspoon of a medication. So yeah, you can't really eyeball these sorts of things. So whenever I have someone come and ask me a question about what to give a child for allergies or for a cold, uh, I always have dosing spoons in the pharmacy, and I will give you one, and I'll point out, I'll even make a little marking on it with a Sharpie that says, you give them this much. And if this rubs off, come back and see me. I'll give you another one.
I love that. Because I'm not, I just can't imagine as a parent, your kid doesn't feel good. You're trying to figure out what's going on. It's usually 9 o'clock at night when you're out searching for something and you're frustrated. So I love the fact that you have sort of stuff set up in case you get that question. That's great. I think if I were listening to this, what we're talking about, I would say, okay, you guys have talked about Benadryl, you talked about Claritin and Zyrtec, but what's this Claritin D, Zyrtec D? Like, what makes that different? And then why do I have to stand in line at the at the glass window? If I can buy Claritin, why can't I get the Claritin? What does the D do to Claritin that makes it so special that only special people can handle it, hand it out behind a glass wall?
Yeah, well, when we talk about the D products, this is the same antihistamine that we mentioned before, but they've added a decongestant drug to it as well.
Okay.
So the decongestant is just a medication that opens up your nose a little bit. So you're in that unique situation where you have the runny nose and the itchy eyes, but then sometimes it just feels plugged up and you can't breathe. Also, it's the worst feeling.
You're like,
Because you're
why is
getting
my
both
nose
ends.
running if my ears are clogged? I don't understand. This is the most,
Yes.
yeah, I get it. Okay. Because people may go, why do you have a drug that dries you up with a drug that unblocks your nose into one product? That would confuse me.
Yeah. Yeah. And I have lots of times patients will come to me and they'll say, well, I need to get the Zyrtec D. Like, well, describe your symptoms to me. And nowhere in there is, I need a decongestant. That's just, that's what they've used. It works. The reason that those products are kept behind the counter, it goes back to about 15 years ago, around 2005. The federal law changed, and any product that has a nasal decongestant, specifically the one called pseudoephedrine, and that product's available by itself, just called Sudafed. It has to be held behind the counter, and a pharmacist actually has to sell that to you. Because there's limits, the federal and state laws have put limits forth on how much you can purchase in a day and in a month. It's cumulative, it stacks up.
So, and then that's not one that necessarily you would take every day, right? I mean, that might be something you, once again, you can take as you need it when you're stuffy,
Right,
but you don't need
absolutely.
it every day. Yeah.
Right, yeah, and the thing about decongestants, they just how they work, and I don't want to go too much into that, but they're very likely to cause someone who has high blood pressure to have their blood pressure go up.
Yeah.
From that medication. So it's never recommended that a patient with high blood pressure, or I even go so far to say, if you've had any sort of cardiovascular disease or heart problems, and your doctor's ever diagnosed you with anything like that, let's just avoid the decongestants altogether. I know it sucks. Your nose is plugged up. We'll figure it out, but I don't want to risk causing any more harm to you by adding on a decongestant.
Well, and you bring up a good point, because decongestants, where we talked about the antihistamines kind of slow you down and make you groggy, the decongestants can rev you up and make your heart beat fast, move your blood pressure. And they also will mess up your thyroid a little bit too.
They will.
And so this is important, why you just can't walk in and go, I'm going to grab a Zyrtec D. And somebody goes, well, tell me what's wrong. Because you could cause some problems here if your blood pressure is not controlled to begin with, and then you pop one of these products. I mean, I know they're over the counter and supposedly they're safe, but I think what we're finding is the pharmacist is the one that can answer you about how safe it is just for you, not the general public. Yeah. Yeah.
Right. Yeah. When these products go over the counter, they've been deemed safe for the general public to use, as long as the manufacturer has ensure that it's the actual drug and that the labeling is adequate for any normal person to read and get the gist of it.
Right.
But everyone's a unique person, you know, and when I was in school, and I'm sure when you were too, we were taught to treat the patient, not each person's individual. So that's why I'm there, asking you the questions. That's why we went to school for it.
That's what every pharmacist is there. You know, and you bring up you said the word Sudafed earlier, and I don't think people realize some of the branded drugs, like if they're over the counter, may not have the same ingredients as those generic words that you keep saying. So there's a Sudafed you can buy without going to the pharmacist that has a different decongestant in it, right? I don't want people to think, oh, the pharmacist has Sudafed and I found it on the counter. I found something. It's different, right? It's not the same active drug. Okay. And it's not as good. And this is a pharmacist talking, two pharmacists. I don't think it's as good. The one that we buy over the counter, if I want to get unstuffed, the pseudoephedrine and the one that you have behind the counter, I think it's safer and works a bit better than the one that you can buy over the counter, but it's got the same brand name, right?
Exactly.
Talk about confusing the public, man.
You know, it's brand recognition, and it's a marketing thing. It really is. But you do have a patient, and the marketing will say, okay, we have established that Sudafed equals unstuffing your nose, but that doesn't necessarily mean that the product that you're actually getting with that labeling and branding on it is what you think it is.
Yeah, that's kind of.
I've seen the same. Yeah, I've seen the same thing with some other products. Even if we're looking at, you know, topical creams, you know, like we said, Benadryl could be used for bee stings and rashes and things like that because it's an allergic response. But I've seen where Allegra has a cream available for the same thing. There's not the drug Allegra is not in that product. It's a branding thing. In fact, I think Benadryl is in that cream.
It is. You're absolutely correct.
So it's extremely confusing.
And there's one of the things where I tell people, flip it over and look at it. And sometimes those words are hard to read. Talking to the pharmacist will at least, number one, make you a better consumer. But number two, it may save you some grief and spending some money on something that you thought you got one thing, but you didn't. This is one of the only examples I can think of where we've branded it, but the manufacturers have put a different ingredient in it. And it's, to me, I don't think it's fair. That's why I love the pharmacists are there to kind of to help answer those questions. We talked about oral decongestants like Sudafed. The other one that is called phenylephrine.
Phenylephrine.
Thank you. Oh my gosh, you're better at that than I am. So those two are the oral, but you can also use nasal sprays or nasal drops that are decongestants too.
Right.
And
right.
What's the most popular one that you see people buy?
So usually when someone's asking for a nasal decongestant spray, they're thinking of Afrin. Afrin's been around forever.
That's true.
And it's there's really two nasal decongestants, and I've seen Afrin label both of them as Afrin, but it just really depends on how frequent you need to use it. There's a problem with nasal decongestants. They work very well. They're not absorbed into your entire body like the Sudafed is, so it's less likely to cause you to have the amp you up and have you have the increased heart rate and the blood pressure going up and things like that, because just like the Flonase and the nasal steroids, it's staying in your nose. The problem with those, if you're going to use it for more than, let's say, 3 or 4 days, you have to take a break, because that medication, your nose gets used to it, and you get it's called rebound congestion. So even if you continue to use the product, it's no longer working, and you get right back to square one again. So it's really just a very as needed, very short-term use. I've even recommended some patients do a spray of Afrin to open up their nose enough to use the Flonase to make sure that the Flonase gets in.
I've heard that too. Now, but how many days in a row should I use Afrin before I get this rebound effect?
I'd say no more than 7.
All right.
If you 7 days is probably the upper limit.
Yeah. I've heard people talk about, sticking 3 to 4 days to make sure and then give yourself a break. And if you're using that
Right.
much, you probably need to talk to your primary care physician because you need more than just this.
Right.
You probably need a drug that you take every day if you're using this stuff every day. I love your idea though. If I'm a little stuffed up, if I do a little bit of Afrin, I then use my nasal spray, my steroid,
Mhm.
then I use that every day and I shouldn't have to ever have the Afrin again because it keeps my inflammation down. That's a good idea.
Right.
Yeah,
Yeah.
I like that. We'd be remiss if we didn't just sort of stop for a second and say, okay, here's this nasal spray, but come on. You talked earlier about how somebody can't use decongestants, and with pregnant women, we worry about, obviously they're carrying the little one, but
Mhm.
salt water.
Yeah.
How great are
Yeah.
saltwater nasal sprays at sort of helping you break up the junk and getting you unclogged?
Absolutely. So you'll see a lot of products out there, and they're just called a saline or saltwater nasal sprays. Or you may have had some experience in the past with a neti pot or a nasal irrigation or rinse.
Right.
So really, what that is it's a salt water solution that there's just enough salt added to that so that it won't irritate the linings of your sinuses and your nose. And it's just really good for flushing everything out. Your nose is really good at capturing and holding on to any allergens so they don't get down into your lungs. So these nasal washes is almost like just flushing it out, giving a good rinse to everything. And that's highly recommended not only to pregnant and nursing women, those that can't use decongestants, and for the little babies, the infants. That's about the only thing I would really recommend. Just get a little nasal spray and just try to rinse everything out.
Yeah. And I've seen a lot of people use those, and there's some branded ones out there, but the generics work. But you mentioned the word neti pot, which made me just react. You know, you read the articles, it really is quite good to flush your sinuses. But I think, we need to warn people, if you're going to use those, you need to use sterile water. This is not tap
Absolutely.
water or bottled water. It has to be sterile water. And people are like, well, why? And I'm like, well, you're letting that run through your sinuses. You don't want anything that could be growing in that water to get up in your nose.
Absolutely.
So, there's some folks who live by neti pots. They won't use the drugs. They think the neti pots are normal, and I'm normal. They think that are more natural, and I don't have a problem with that. But I just want to tell people, if you can do it, more power to you. Because I'm like, wow. And the second part of it is sterile water has to be used with these. If you're making a neti pot and putting it through, it's really important that you guys do that, because otherwise you could end up with a big infection in your sinuses.
Exactly.
So, Dr. Blake, we have walked down the allergy aisle today. We've covered a lot. We've talked about kids and pregnant ladies and how to choose this over that, and talk to the pharmacist about
Yeah.
all these things. If you had
I'm
to,
exhausted. I'm sure
I
you are
know, I'm like,
now.
this is a lot. But if we're exhausted just talking about this on this podcast, what is it like walking down the aisle as a consumer or a patient trying to figure out, I just want to feel better. This pollen is killing me. So having a pharmacist like yourself in that setting, what a great resource for our patients and for the community. If you had to sum up 3 pearls, I always ask the guest, give me 3 pearls about what we talked about today. So if people tuned in the last 5 minutes of this, what things would you want them to walk away with?
Okay. Number one, the nasal steroids are that's your go-to. That's what I'm recommending for almost every person who complains about allergies.
Okay.
It works long term. You can use it every day. It's safe. It's effective. It's not super expensive. Go with the cheapest one if you've never used it, and then move up in price till you find something that works for you.
And that's a daily, every day. That's a good one though. And it works for, you said kids from 3 and up.
Yes,
So, I mean,
absolutely.
yeah, so there's a good one. And then buy the generic, save yourself some cash. So,
Absolutely.
all right.
Mhm.
What's number 2?
Number two, if you're going to go the route of taking an oral antihistamine to dry you up, get away from the Benadryl. It's effective, it works, but there's just so many risks of drowsiness associated with it. And it's not good for kids. If you're an older patient, it can cause a lot of issues with that. Go with the newer ones. Go with the Claritin, the Zyrtec, and their generics. You can take it daily. You can take it just for a couple of days if you have just intermittent allergies. You can also stack it with the nasal spray, and there's nothing wrong with doing that also. I don't think there's been limited data that shows that doing both of them together is any more effective than just doing the nasal spray. But I'd rather you do the Claritin, the Zyrtec, the Allegra as opposed to the Benadryl.
Especially like on your bad days, right? Like you do your nasal spray, then you take an extra Allegra if the pollen is just up and, or you're working in the lawn. Maybe that's the day you're getting out there to work in your garden.
Mhm.
You said something too on there, the Benadryl for men with prostate problems or with enlarged prostates, stay away from the Benadryl and those two. We didn't say that, but I'll call that out just because there's some other side effects too. And what's that third pearl?
Ooh, the third one. Remember that decongestants are not all made the same. And the ones who are behind the counter, although they're more potent, if you have these conditions like high blood pressure, or cardiovascular disease, or glaucoma, you really need to talk to your doctor first and see, is this something that's safe for me to use? And let your pharmacist know this. If you're thinking to buy this, check the over-the-counter products also. Just because it's not behind the counter doesn't mean that it does not have a nasal decongestant in it. It may not be as potent as the one that's behind the counter. So always flip that over and read those labels before you make a purchase.
That's a really good thing. And, if we had to take that one step further, make sure your pharmacist and your primary care physician know that you're buying over-the-counter medications and you're using them every day, because they could say, no, that one's not for you. Don't do that one. So those are great, though. Dr. Blake, thank you so much for joining us.
Absolutely.
We take great pride in pharmacists in Georgia, and we always want to highlight people what they're doing. I think what you're doing is amazing. I love the fact you're involved in so many things, from working in the community at the store, but also with chronic management, working with one of the local physicians in Gwinnett County. Thank you again for coming on, and it's great to have you as a pharmacist in the profession, although I was just as happy when you were a technician, because I bet you were a stellar technician in your day. So thank you so much.
Thank you, Dr. Brown. Appreciate that.
For those out there, thanks so much for joining us for the May edition of PharmCast for the Community, sponsored by UGA's College of Pharmacy. As always, we wish you good health. Stay in there, listen to us, and hopefully we can give you points and tips from the pharmacy world to keep you healthy. Talk to you soon, and thanks for joining.